Question 1. The assessment process reveals a 9-year-old child presenting with significant school refusal, characterized by somatic complaints, headaches, stomachaches, and tearfulness when discussing school. The child reports worrying about not being smart enough and being laughed at by peers. Parents express distress and are seeking immediate relief. Which of the following therapeutic approaches is most aligned with evidence-based practice for this presentation? Option A. Recommending immediate initiation of a selective serotonin reuptake inhibitor, SRI, to rapidly alleviate the child's anxiety symptoms, with minimal emphasis on behavioral interventions. Option B. Utilizing non-directive play therapy to allow the child to express emotions freely, without explicitly targeting the cognitive distortions or behavioral avoidance related to school. Option C. Implementing a structured cognitive behavioral therapy, CBT, program that includes psychoeducation on anxiety, teaching relaxation techniques, cognitive restructuring to challenge negative thoughts about school, and a gradual exposure hierarchy to increase school attendance. Option D. Focusing exclusively on parental education regarding anxiety management strategies and providing resources for parental self-care, assuming that addressing parental stress will resolve the child's symptoms. Correct answer is C. Implementing a structured cognitive behavioral therapy, CBT program that includes psychoeducation on anxiety, teaching relaxation techniques, cognitive restructuring to challenge negative thoughts about school, and a gradual exposure hierarchy to increase school attendance. Explanation. This scenario presents a professional challenge due to the need to balance evidence-based practice with the unique developmental and emotional needs of a pediatric patient experiencing anxiety related to school. The clinician must select a cognitive behavioral therapy, CBT, intervention that is not only theoretically sound, but also developmentally appropriate and ethically aligned with pediatric care standards. Careful judgment is required to ensure the intervention is effective, safe, and respects the child's autonomy and family involvement. The correct approach represents best professional practice by directly addressing the child's identified cognitive distortions and behavioral avoidance patterns through age-appropriate CBT techniques. This aligns with the principles of evidence-based practice in pediatric mental health, emphasizing interventions proven effective for anxiety in children. Specifically, psychoeducation about anxiety, teaching coping skills like deep breathing and progressive muscle relaxation, and gradual exposure to feared situations, e.g., attending school for short periods, are core CBT components validated for this population. This approach respects the child's developmental stage by using concrete examples and engaging activities, and it promotes collaboration with parents/guardians for reinforcement and support, which is a cornerstone of ethical pediatric practice. An incorrect approach that focuses solely on parental anxiety management fails to directly address the child's primary presenting problem and may inadvertently disempower the child. While parental support is crucial, it is not a substitute for direct intervention with the child experiencing the anxiety. This approach could be considered ethically questionable, as it deviates from the most direct and effective treatment for the identified patient. Another incorrect approach that involves immediate pharmacological intervention without a thorough trial of evidence-based behavioral therapies is premature and potentially disregards the established efficacy of CBT for pediatric anxiety. While medication may be a consideration in some cases, it is typically considered after or in conjunction with behavioral interventions, not as a first-line response to school-related anxiety in a child who has not yet received comprehensive CBT. This approach could be seen as a failure to adhere to best practice guidelines and potentially an overreach in prescribing without exhausting less invasive, evidence-based options. A further incorrect approach that involves solely relying on play therapy without integrating specific CBT techniques for anxiety management might not adequately address the cognitive distortions and behavioral patterns contributing to the child's school refusal. While play therapy can be beneficial for emotional expression, a targeted CBT approach is generally indicated for specific anxiety disorders with identifiable cognitive and behavioral components. This approach risks being less effective for the specific problem of anxiety and school avoidance. Professional decision-making process for similar situations should involve a thorough assessment of the child's presenting problem, including cognitive, behavioral, emotional, and environmental factors. This should be followed by a review of evidence-based treatment modalities for pediatric anxiety, considering the child's developmental level and family context. The clinician should then select an intervention that directly targets the identified issues, is ethically sound, and involves collaborative decision-making with the child and family. Ongoing monitoring of progress and adjustment of the treatment plan based on the child's response are also critical components of professional practice. Question 2. Analysis of a situation where a parent expresses significant concern that their 18-month-old child is not developing right physically, citing observations of clumsiness and difficulty with fine motor tasks like stacking blocks, while the child appears generally active and meets some gross motor milestones. The pediatric clinical specialist, PCS, must determine the most appropriate course of action. Which of the following represents the best professional practice? Option A. Focus solely on the child's ability to walk and run, as these are the most critical gross motor skills at this age, and dismiss concerns about fine motor skills as less significant. Option B. Reassure the parent that the child is meeting basic gross motor milestones and advise them to wait and see if the concerns resolve on their own, as children develop at different paces. Option C. Conduct a comprehensive physical examination. Utilize age-appropriate standardized developmental screening tools to assess fine and gross motor skills, and engage in a detailed discussion with the parent to understand their specific observations and concerns, integrating all findings into a developmental assessment. Option D. Immediately refer the child to a developmental pediatrician without performing an initial assessment based solely on the parent's subjective report of developmental concerns. The correct answer is C. Conduct a comprehensive physical examination. Utilize age-appropriate standardized developmental screening tools to assess fine and gross motor skills, and engage in a detailed discussion with the parent to understand their specific observations and concerns, integrating all findings into a developmental assessment. Explanation. Scenario analysis. This scenario presents a common challenge for pediatric clinical specialists, PCS, where a parent's perception of their child's physical development deviates from objective clinical findings. The challenge lies in balancing parental concerns, which are valid and important, with the need to provide evidence-based care and accurate developmental assessments. Misinterpreting or dismissing parental input can erode trust, while overemphasizing subjective parental reports without objective validation can lead to inappropriate interventions or delayed diagnosis. The PCS must navigate this delicate balance with sensitivity and clinical expertise. Correct approach analysis. The correct approach involves a comprehensive assessment that integrates objective clinical observations with the parent's subjective report. This aligns with best professional practice as outlined by the PCS regulatory framework, which emphasizes a holistic and family-centered approach. By conducting a thorough physical examination, utilizing standardized developmental screening tools, and actively listening to and validating the parent's concerns, the PCS demonstrates adherence to ethical principles of beneficence, acting in the child's best interest, and respect for autonomy, acknowledging the parent's role in their child's care. This approach ensures that any developmental delays are identified accurately and addressed appropriately, while also fostering a strong therapeutic relationship with the family. Incorrect approach is analysis. One incorrect approach is to solely rely on the parent's subjective report without conducting an objective clinical assessment. This fails to meet the PCS's professional obligation to provide evidence-based care and can lead to misdiagnosis or overlooking significant developmental issues. Ethically, it neglects the principle of non-maleficence by potentially delaying necessary interventions. Another incorrect approach is to dismiss the parent's concerns outright and rely exclusively on objective findings, without acknowledging or exploring the parent's perspective. This can alienate the family, damage the therapeutic alliance, and may cause the parent to seek care elsewhere, potentially leading to fragmented care. It violates the ethical principle of respect for persons by not valuing the parent's lived experience and insights. A third incorrect approach is to focus only on gross motor skills and ignore other domains of physical development, such as fine motor skills, sensory processing, or coordination. When the parent expresses general concerns about not developing right, this narrow focus can lead to an incomplete picture of the child's development and may miss subtle but important developmental challenges. It fails to adhere to the comprehensive scope of practice expected of a PCS. Professional reasoning. Professionals should approach such situations by first establishing rapport and actively listening to the parent's concerns, validating their feelings. This should be followed by a systematic and comprehensive physical and developmental assessment, utilizing appropriate tools and techniques. The findings from the objective assessment should then be discussed with the parent in a clear, empathetic, and understandable manner, explaining the rationale for any discrepancies between their observations and the clinical findings. Collaborative goal setting and a clear plan for follow-up or referral, if indicated, are crucial steps in ensuring optimal child outcomes and maintaining family trust. Question 3. The assessment process reveals that a 4-year-old child exhibits significant delays in fine motor skills, specifically in tasks requiring pincer grasp, bilateral coordination for manipulation, and controlled release. The child demonstrates frustration during these activities and has limited engagement. The parents are eager to support their child's development but are unsure of how to best proceed. Considering the regulatory framework for pediatric clinical specialists, which of the following implementation strategies would be most appropriate? Option A. Advise parents to continue observing the child's attempts at fine motor tasks and to encourage them to find online resources for self-directed practice without providing specific intervention strategies or direct therapeutic input. Option B. Prescribe a costly, cutting-edge therapeutic device for home use that promises rapid improvement in fine motor skills, without first exploring simpler, more accessible intervention methods or assessing its suitability for the child's specific deficits. Option C. Implement a play-based intervention program that incorporates activities targeting pincer grasp, bilateral coordination, and controlled release through engaging toys and games, while simultaneously educating parents on how to integrate these skills into daily routines and modify the home environment to support practice. Option D. Recommend a series of intensive, highly specialized fine motor drills focusing on isolated finger movements to be performed for extended periods daily, with minimal parental involvement to avoid interference. Correct answer is C. Implement a play-based intervention program that incorporates activities targeting pincer grasp, bilateral coordination, and controlled release through engaging toys and games, while simultaneously educating parents on how to integrate these skills into daily routines and modify the home environment to support practice. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric clinical practice where a child's developmental progress in fine motor skills is not meeting age-expected milestones. The professional's responsibility extends beyond simply identifying the deficit. It involves implementing an effective intervention strategy that is both evidence-based and tailored to the child's specific needs and family context. The challenge lies in selecting the most appropriate intervention approach from various possibilities, considering the limited time and resources often available, and ensuring that the chosen method aligns with best practices and regulatory guidelines for pediatric care. Correct approach analysis. The correct approach emphasizes a multifaceted strategy that includes direct intervention, caregiver education, and environmental modifications. This aligns with the principles of family-centered care, which is a cornerstone of pediatric practice. By involving the caregivers, the professional empowers them to continue supporting the child's development outside of therapy sessions, thus maximizing the impact of interventions. Furthermore, incorporating play-based activities and adapting the environment addresses the child's engagement and reduces potential barriers to skill development. This holistic approach is supported by evidence demonstrating its effectiveness in improving fine motor skills in children and is consistent with regulatory frameworks that prioritize comprehensive and individualized care plans. Incorrect approaches analysis. One incorrect approach focuses solely on repetitive drills without considering the child's engagement or the functional application of skills. This fails to acknowledge that children learn best through play and meaningful activities. Ethically, it could be considered a failure to provide care that is in the child's best interest if it leads to frustration and disengagement, potentially hindering progress. Regulatory frameworks often mandate interventions that are developmentally appropriate and promote positive engagement. Another incorrect approach involves recommending a highly specialized, expensive therapy without first exploring more accessible and integrated interventions. This could be seen as a failure to provide cost-effective care and may not be the most appropriate first-line intervention, especially if simpler strategies could yield significant improvements. It might also violate ethical principles of resource stewardship and equitable access to care. A third incorrect approach is to solely rely on parental observation and self-directed learning without providing structured guidance or direct intervention. While parental involvement is crucial, expecting parents to independently devise and implement effective fine motor interventions without professional support is unrealistic and potentially detrimental to the child's progress. This approach neglects the professional's responsibility to provide expert assessment and intervention planning, which is a regulatory expectation. Professional reasoning. Professionals should approach such situations by first conducting a thorough assessment to identify specific fine motor deficits and contributing factors. This should be followed by collaborative goal setting with the family. The intervention plan should be evidence-based, developmentally appropriate, and consider the child's interests and the family's capacity. Regular reassessment and adjustment of the plan are essential to ensure ongoing progress and to adapt to the child's evolving needs. Professionals must always adhere to ethical codes and regulatory guidelines that mandate individualized, family-centered, and effective care. Question 4. Governance review demonstrates that a pediatric clinical specialist is assessing a 3-year-old child presenting with a sudden onset of irritability and decreased oral intake. The specialist is considering how to best approach the clinical observation to identify potential risks. Which of the following approaches would be most aligned with best professional practice for risk assessment in this scenario? Option A. Systematically observe the child's behavior, respiratory effort, skin color, and level of consciousness, while also actively eliciting information from the parents regarding the onset and progression of symptoms and any recent exposures. Option B. Focus exclusively on monitoring the child's heart rate and blood pressure, as these are the most critical indicators of acute distress. Option C. Initiate immediate intravenous fluid resuscitation based on the initial report of decreased oral intake. Without further detailed observation, Option D. Primarily rely on the parent's description of the child's symptoms, assuming their observations accurately reflect the severity of the situation. The correct answer is A. Systematically observe the child's behavior, respiratory effort, skin color, and level of consciousness, while also actively eliciting information from the parents regarding the onset and progression of symptoms and any recent exposures. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in pediatric presentations and the critical need for accurate, timely assessment in a potentially unstable patient. The specialist must balance the need for comprehensive observation with the urgency of the situation, ensuring that interventions are guided by evidence-based clinical judgment rather than assumptions. The risk of misinterpreting subtle cues or overlooking critical signs necessitates a systematic and well-informed approach to clinical observation. Correct approach analysis. The correct approach, focusing on systematic multimodal observation that integrates direct patient assessment with caregiver input and environmental cues, represents best professional practice. This aligns with the pediatric clinical specialist, PCS, role's emphasis on holistic patient care and evidence-based practice. Regulatory frameworks and ethical guidelines for pediatric care mandate thorough assessment, patient advocacy, including caregiver input, and the application of specialized knowledge. By observing the child's behavior, physiological parameters, and interaction with the environment, and by actively soliciting information from the parents, the specialist can build a comprehensive picture of the child's status, identify potential risks, and formulate an appropriate management plan. This approach minimizes the risk of diagnostic error and ensures patient safety, a paramount ethical and regulatory obligation. Incorrect approach is analysis. An approach that relies solely on parental reports without direct, objective observation would be a regulatory and ethical failure. While parental input is vital, it cannot replace the specialist's trained eye and objective assessment of the child's condition. This could lead to missed critical signs or an over-reliance on subjective information, potentially delaying necessary interventions. An approach that focuses exclusively on a single physiological parameter, such as heart rate, while neglecting other observable signs like respiratory effort, skin color, or level of consciousness, would also be a significant failure. This narrow focus is insufficient for a comprehensive risk assessment in pediatrics and violates the principle of thoroughness expected of a specialist. It risks overlooking a constellation of symptoms that, when viewed together, indicate a more serious underlying issue. An approach that prioritizes immediate intervention based on a single, potentially misleading observation, without a period of careful, systematic observation, would be professionally unsound. While prompt action is sometimes necessary, it must be informed by a reasoned assessment. Acting solely on an isolated finding without considering the broader clinical picture can lead to unnecessary or even harmful interventions, failing to meet the standard of care and potentially violating ethical obligations to avoid harm. Professional reasoning. Professionals should employ a structured decision-making process that begins with a clear understanding of the presenting problem and the patient's history. This is followed by a systematic, multimodal assessment that includes direct observation of the patient, consideration of physiological data, and active engagement with caregivers. The gathered information is then synthesized to identify potential risks and formulate a differential diagnosis. This iterative process allows for ongoing reassessment and adjustment of the management plan as new information becomes available, ensuring that care remains patient-centered and evidence-based. Question 5. Research into the effectiveness of the Ages and Stages questionnaire, ask, in identifying potential developmental delays in a 2-year-old child has yielded a score indicating a need for further attention in the communication domain. As a pediatric clinical specialist, PCS, what is the most appropriate next step in managing this situation? Adhering strictly to U.S. pediatric clinical guidelines and regulatory frameworks for early intervention services. Option A. Document the ASQ result and inform the parents that no further action is required as the ASQ is not a diagnostic tool. Option B. Inform the parents that the ASQ indicates a potential delay and advise them to monitor the child's development closely without further immediate action. Option C. Immediately refer the child to a speech-language pathologist for a full diagnostic evaluation based solely on the ASQ screening score. Option D. Initiate a comprehensive clinical assessment to further evaluate the child's communication skills and consult with the child's primary care provider to discuss the ASQ findings and recommend appropriate follow-up. The correct answer is D. Initiate a comprehensive clinical assessment to further evaluate the child's communication skills and consult with the child's primary care provider to discuss the ASQ findings and recommend appropriate follow-up. Explanation. This scenario presents a professional challenge because the pediatric clinical specialist, PCS, must interpret and act upon developmental screening data from the Ages and Stages questionnaire ask, within the context of established pediatric care guidelines and regulatory expectations for early intervention. The ASQ is a tool, not a diagnosis, and its results necessitate a nuanced approach that balances the need for timely intervention with the avoidance of unnecessary alarm or misinterpretation. The PCS must consider the child's overall developmental trajectory, parental concerns, and the ASQ's limitations. The correct approach represents best professional practice, because it aligns with the principles of evidence-based pediatric care and regulatory frameworks that emphasize comprehensive assessment and appropriate referral. By using the ASQ as a screening tool to identify potential areas of concern, and then proceeding with a more in-depth clinical evaluation and consultation with the child's primary care provider, the PCS ensures that any identified delays are addressed systematically and with appropriate professional input. This approach respects the ASQ's intended use as a screening mechanism and upholds the ethical obligation to provide accurate and responsible guidance to families. An incorrect approach that focuses solely on the ASQ score without further clinical correlation fails to meet regulatory and ethical standards, risks over-identifying children as having developmental delays, leading to parental anxiety and potentially unnecessary, costly, or inappropriate interventions. This bypasses the established protocols for developmental assessment and referral, which are often mandated or guided by regulatory bodies overseeing pediatric health services. Another incorrect approach that dismisses ASQ results without a thorough clinical review also poses significant risks. This could lead to missed opportunities for early intervention, which is a critical component of pediatric care and often a focus of regulatory oversight. Failing to investigate potential developmental concerns identified by a validated screening tool can result in delayed diagnosis and treatment, negatively impacting a child's long-term developmental outcomes and potentially violating professional standards of care. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge the ASQ as a screening tool, not a diagnostic instrument. 2. Consider the ASQ results in conjunction with direct clinical observation and parental input. 3. Consult with the child's primary care provider to discuss findings and formulate a collaborative plan. 4. Ensure all actions are documented and align with current pediatric practice guidelines and any relevant regulatory mandates for developmental screening and referral. Question 6. Compliance review shows a pediatric clinical specialist, PCS, is developing an intervention plan for a 5-year-old child exhibiting frequent temper tantrums and difficulty calming down after minor frustrations. The PCS is considering several approaches to support the child's emotional regulation. Which of the following approaches best aligns with current pediatric clinical best practices and ethical guidelines for emotional regulation support in this age group? Option A. Implementing a structured program focused on teaching the child specific, age-appropriate calming techniques, such as deep breathing exercises and sensory grounding strategies, while actively involving the parents in modeling and reinforcing these skills at home. Option B. Prescribing medication to manage the child's emotional reactivity without a prior comprehensive psychological or developmental assessment to rule out other contributing factors. Option C. Suggesting that the child's emotional expressions are a normal part of development and advising the parents to ignore the tantrums, believing that the behavior will naturally resolve without direct intervention. Option D. Recommending immediate parental discipline strategies to strictly enforce behavioral limits during tantrums, with the expectation that the child will learn to suppress emotional outbursts through consistent punishment. The correct answer is A. Implementing a structured program focused on teaching the child specific, age-appropriate calming techniques, such as deep breathing exercises and sensory grounding strategies, while actively involving the parents in modeling and reinforcing these skills at home. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent variability in how pediatric patients express and manage emotional distress. Pediatric clinical specialist, PCS, must navigate the complexities of developmental stages, individual temperaments, and potential underlying medical or psychological conditions that can influence emotional regulation. The challenge lies in distinguishing typical developmental fluctuations from signs of significant distress requiring intervention, while also respecting the child's autonomy and the family's cultural context. Careful judgment is required to select interventions that are age-appropriate, evidence-based, and tailored to the specific child's needs and the family's capacity to support them. Correct approach analysis. The correct approach involves a comprehensive assessment of the child's emotional regulation skills within their developmental context. This includes observing the child's typical responses to stressors, identifying their coping mechanisms, and understanding the family's role in supporting their emotional regulation. The PCS should then collaborate with the family to develop a personalized intervention plan that utilizes developmentally appropriate strategies, such as teaching specific calming techniques, modeling emotional expression, and reinforcing positive coping behaviors. This approach aligns with ethical principles of beneficence and non-maleficence, ensuring interventions are in the child's best interest and minimize harm. It also adheres to professional guidelines that emphasize individualized care and family-centered practice. Incorrect approaches analysis. One incorrect approach would be to immediately implement a standardized, one-size-fits-all behavioral modification program without a thorough assessment of the child's individual needs and developmental stage. This fails to acknowledge the unique nature of pediatric emotional regulation and could be ineffective or even detrimental, potentially leading to increased frustration or anxiety for the child. This approach risks violating the ethical principle of providing appropriate care and could be seen as a failure to meet professional standards of practice. Another incorrect approach would be to solely focus on suppressing the child's negative emotions without addressing the underlying causes or teaching constructive coping strategies. This approach neglects the importance of emotional literacy and can hinder the child's long-term development of healthy emotional regulation skills. Ethically, this could be considered a failure to promote the child's well-being and development. A third incorrect approach would be to dismiss the child's emotional expressions as simply being difficult or seeking attention without further investigation. This demonstrates a lack of empathy and professional curiosity, potentially overlooking significant underlying issues that require clinical attention. This approach represents a failure to uphold the professional responsibility to assess and address patient needs comprehensively. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough, individualized assessment. This assessment should consider the child's developmental trajectory, their specific stressors, their existing coping mechanisms, and the family support system. Following the assessment, the professional should engage in collaborative goal setting with the family, prioritizing interventions that are evidence-based, developmentally appropriate, and culturally sensitive. Continuous monitoring and evaluation of the intervention's effectiveness are crucial, with adjustments made as needed. This iterative process ensures that care remains patient-centered and ethically sound. Question 7. The risk matrix shows a moderate likelihood of a severe outcome if a neonate presents with subtle signs of respiratory distress. A pediatric clinical specialist is tasked with assessing this neonate. Which of the following assessment techniques best mitigates this risk by ensuring a comprehensive and accurate evaluation? Option A. Conducting a thorough head-to-toe physical examination, including detailed respiratory assessment, vital signs, neurological status, and skin assessment, while also eliciting information from the parents about feeding, activity, and any observed changes. Option B. Performing a focused assessment of breath sounds and observing chest wall movement, while relying primarily on the parent's description of the infant's feeding and activity levels. Option C. Prioritizing a rapid assessment of the infant's color and heart rate, assuming that other vital signs will be within normal limits if these two are stable. Option D. Relying on a quick visual inspection of the infant's general appearance and asking the parents if they have any concerns, without performing a detailed physical examination. The correct answer is B. Performing a focused assessment of breath sounds and observing chest wall movement, while relying primarily on the parent's description of the infant's feeding and activity levels. Explanation. The scenario presents a common challenge in pediatric clinical practice. Assessing a child with a potentially serious condition where subtle signs might be missed, leading to delayed or incorrect management. The professional challenge lies in the inherent difficulty of obtaining a reliable history from a young child, and the need to interpret nonverbal cues and subtle physiological changes accurately. This requires a high degree of clinical acumen, adherence to established assessment protocols, and an understanding of developmental variations. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based assessment that accounts for the child's developmental stage and potential for rapid deterioration. This aligns with regulatory frameworks that mandate competent and comprehensive patient care, emphasizing the use of validated assessment tools and techniques. Specifically, it reflects the ethical obligation to provide care that is in the best interest of the child, minimizing harm and maximizing the potential for positive outcomes. Adherence to established pediatric assessment guidelines ensures that critical information is not overlooked and that interventions are timely and appropriate, thereby upholding professional standards and patient safety. An incorrect approach that relies solely on parental report without independent clinical verification fails to meet professional standards. Parents, while valuable informants, may have biases, anxieties, or incomplete observations, and their subjective interpretation of symptoms cannot replace objective clinical assessment. This approach risks overlooking crucial objective findings, potentially leading to misdiagnosis or delayed treatment, which constitutes a failure to provide competent care as required by regulatory guidelines. Another incorrect approach that focuses only on a single system assessment, such as respiratory status, without a comprehensive head-to-toe evaluation, is also professionally unacceptable. Pediatric patients can present with multisystem involvement, and a narrow focus can lead to missing other significant signs and symptoms that contribute to the overall clinical picture. This demonstrates a lack of thoroughness and adherence to comprehensive assessment principles, potentially violating the duty of care. A third incorrect approach that prioritizes speed over accuracy, performing a superficial assessment to quickly move to the next patient, is a direct contravention of professional ethics and regulatory requirements. Patient safety and the quality of care are paramount, and any assessment must be sufficiently detailed and accurate to guide appropriate management. Rushing the assessment compromises the ability to identify critical findings and can lead to adverse events, representing a significant ethical and professional failing. The professional decision-making process for similar situations should involve a structured approach. First, gathering subjective data from all available sources, parents, caregivers, child if able. Second, performing a systematic and comprehensive objective assessment, utilizing age-appropriate techniques and validated tools. Third, synthesizing subjective and objective data to form a differential diagnosis. And finally, developing and implementing a management plan based on the assessment findings, with continuous reassessment and evaluation of the child's response. This iterative process ensures that care is individualized, evidence-based, and responsive to the child's evolving condition. Question 8. Which approach would be most appropriate for a pediatric clinical specialist when a parent expresses significant concern that their child, aged 18 months, is not yet walking independently, despite the child being able to cruise furniture and stand with support, and the parent describes the child as generally active and engaged? Option A. Provide the parent with a generic handout on gross motor development and suggest they focus on encouraging walking at home without conducting any direct assessment or history taking. Option B. Immediately refer the child for comprehensive neurological evaluation and physical therapy assessment, citing the parent's concern as sufficient justification for extensive intervention. Option C. Conduct a thorough developmental assessment using age-appropriate screening tools, gather a detailed developmental and medical history from the parent, and observe the child's gross motor skills in a naturalistic setting before discussing findings and potential next steps. Option D. Reassure the parent that most children walk by 18 months and that their child's ability to cruise indicates they are on track, advising them to wait another month before seeking further evaluation. The correct answer is C. Conduct a thorough developmental assessment using age-appropriate screening tools, gather a detailed developmental and medical history from the parent, and observe the child's gross motor skills in a naturalistic setting before discussing findings and potential next steps. Explanation. Scenario analysis. This scenario presents a common challenge for pediatric clinical specialists, PCS, where a parent expresses concern about their child's developmental progress, but the observed behaviors do not align with typical developmental milestones for the child's age. The challenge lies in balancing parental concerns with objective clinical assessment, avoiding premature labeling, and ensuring appropriate, evidence-based intervention or reassurance. The PCS must navigate potential parental anxiety, the nuances of developmental variation, and the ethical imperative to act in the child's best interest while respecting the parent's perspective. Correct approach analysis. The correct approach involves a comprehensive, multifaceted assessment that integrates objective observation, standardized developmental screening tools, and detailed history taking from the parent. This approach aligns with best practices in pediatric development and is implicitly supported by regulatory frameworks that emphasize evidence-based care and patient-centered communication. Specifically, it adheres to guidelines that mandate thorough evaluation before diagnosis or intervention, ensuring that any recommendations are grounded in objective data and tailored to the individual child's needs. This method respects the parent's input while prioritizing the child's well-being through a systematic and professional evaluation process. Incorrect approach is analysis. One incorrect approach involves dismissing the parent's concerns outright based on a superficial observation or a quick comparison to general milestone charts. This fails to acknowledge the validity of parental intuition and can erode the therapeutic relationship, potentially delaying necessary intervention if the parent's concerns are indeed valid. Ethically, it violates the principle of beneficence by not fully investigating a potential issue. Another incorrect approach is to immediately recommend extensive, costly, or invasive interventions without a thorough assessment. This can lead to unnecessary stress for the child and family, financial burden, and potential misdiagnosis. It disregards the principle of non-maleficence by potentially causing harm through unindicated procedures, and fails to adhere to the regulatory expectation of judicious use of resources and evidence-based practice. A third incorrect approach is to rely solely on anecdotal information or generalized advice without utilizing validated assessment tools or considering the child's specific context. This lacks the rigor required for accurate developmental assessment and can lead to misinterpretations of the child's abilities and challenges. It falls short of the professional standards expected of a PCS, which include the application of standardized and validated assessment methodologies. Professional reasoning. Professionals should approach such situations by first actively listening to and validating parental concerns. This is followed by a systematic process of observation, standardized screening, and detailed history. If concerns persist after initial assessment, a referral for further specialized evaluation is indicated. This structured approach ensures that decisions are data-driven, ethically sound, and in the best interest of the child, while maintaining a collaborative relationship with the family. Question 9. The review process indicates a pediatric clinical specialist, PCS, is managing a pediatric patient suspected of having cystic fibrosis. The PCS is considering ordering genetic testing to confirm the diagnosis. Which of the following actions best aligns with regulatory compliance and ethical best practices for a PCS in this situation? Option A. Order genetic testing and directly inform the minor patient of the results, as they have a right to know about their health status. Option B. Withhold information about genetic testing options from the parents, assuming they will be informed if the diagnosis is confirmed through other means. Option C. Obtain informed consent from the parents for genetic testing, ensuring they understand the purpose, potential outcomes, and implications of the test, and then proceed with testing and communicate results to the parents. Option D. Proceed with genetic testing immediately upon suspicion of cystic fibrosis to expedite diagnosis, as the potential benefits outweigh the need for explicit parental consent. The correct answer is C. Obtain informed consent from the parents for genetic testing, ensuring they understand the purpose, potential outcomes, and implications of the test, and then proceed with testing and communicate results to the parents. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatric clinical specialist, PCS, to navigate complex ethical considerations and regulatory requirements surrounding the disclosure of potentially sensitive genetic information to a minor's family. The PCS must balance the child's right to privacy and future autonomy with the parent's right to information and their role in decision-making, all while adhering to specific pediatric clinical specialist guidelines and relevant U.S. federal and state laws regarding genetic testing and patient confidentiality. The delicate nature of a cystic fibrosis diagnosis, which has genetic implications and lifelong management, amplifies the need for careful, informed, and ethically sound communication. Correct approach analysis. The correct approach emphasizes obtaining informed consent from the parents for genetic testing and ensuring they understand the implications of the results, including potential implications for other family members. This aligns with the ethical principle of beneficence and non-maleficence, ensuring that the family receives accurate information to make informed decisions about the child's care and future. It also respects parental autonomy and their legal right to make healthcare decisions for their minor child. Furthermore, it adheres to the U.S. regulatory framework, such as the Health Insurance Portability and Accountability Act, HIPAA, which governs the privacy and security of protected health information, and state-specific laws that may further define parental rights and responsibilities in pediatric healthcare, especially concerning genetic information. The PCS's role in providing education and support is paramount, ensuring the family is equipped to manage the diagnosis. Incorrect approaches analysis. One incorrect approach involves proceeding with genetic testing without explicit parental consent. This violates fundamental ethical principles of autonomy and informed consent, and directly contravenes federal and state laws that mandate parental consent for medical procedures and testing on minors. It also breaches patient confidentiality and could lead to legal repercussions and loss of trust. Another incorrect approach is to disclose the genetic testing results directly to the minor child without parental involvement or consent, especially given the child's age and the complex nature of the diagnosis. This disregards the legal and ethical responsibility of the PCS to communicate with the legal guardians of a minor. It also fails to consider the child's developmental stage and their capacity to understand such information, potentially causing undue distress and confusion. This also violates HIPAA and state privacy laws. A third incorrect approach is to withhold information from the parents about the availability or implications of genetic testing for cystic fibrosis, even if they have not explicitly requested it. This fails the ethical duty of beneficence and transparency. Parents have a right to be informed about diagnostic options and their potential impact on their child's health and well-being, enabling them to participate meaningfully in their child's care. This also undermines the PCS's role as an educator and advocate. Professional reasoning. Professionals should employ a decision-making framework that prioritizes ethical principles and regulatory compliance. This involves 1. Identifying the ethical issues, autonomy, beneficence, non-maleficence, justice, and relevant regulations, HIPAA state laws. 2. Gathering all necessary information about the child's condition, available tests, and potential outcomes. 3. Consulting with the parents to explain the diagnostic process, obtain informed consent, and address their concerns. 4. Communicating results in an age-appropriate and understandable manner with ongoing support. 5. Documenting all interactions and decisions meticulously. In situations involving genetic information and minors, a heightened level of caution and adherence to legal and ethical guidelines is essential. Question 10. The analysis reveals that a parent expresses significant concern regarding their preschool-age child's difficulty with imaginative play and problem-solving tasks during a routine developmental screening. As a pediatric clinical specialist, PCS, what is the most appropriate initial approach to address these parental concerns and ensure optimal cognitive development for the child? Option A. Focus on addressing the specific play behaviors observed by the parents through direct intervention, without a formal cognitive assessment to avoid overwhelming the family. Option B. Conduct a comprehensive, age-appropriate assessment of the child's cognitive development using standardized tools, and collaboratively discuss the findings and potential strategies with the parents. Option C. Recommend immediate referral to a specialized educational program based on the parent's subjective report of the child's play and problem-solving abilities. Option D. Reassure the parents that such difficulties are common at this age, and suggest they wait and observe for further changes before pursuing any formal evaluation. The correct answer is B. Conduct a comprehensive, age-appropriate assessment of the child's cognitive development using standardized tools, and collaboratively discuss the findings and potential strategies with the parents. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatric clinical specialist, PCS, to balance the immediate needs of a child with the long-term implications of cognitive development, while navigating the complexities of parental understanding and potential anxieties. The PCS must act as an advocate for the child's developmental trajectory, ensuring interventions are evidence-based and developmentally appropriate, while also fostering a collaborative relationship with the parents. This requires not only clinical expertise, but also strong communication and interpersonal skills. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the child's cognitive development using age-appropriate standardized tools. This aligns with the ethical imperative to provide evidence-based care and to act in the best interest of the child. Furthermore, it emphasizes a collaborative approach with parents, ensuring they are informed, involved, and supported in understanding their child's development and any recommended interventions. This respects parental autonomy and promotes adherence to treatment plans, which is crucial for positive outcomes. This approach is consistent with the ethical guidelines for pediatric healthcare professionals, which mandate thorough assessment and informed consent. Incorrect approach is analysis. An approach that focuses solely on immediate symptom management without a thorough cognitive assessment fails to address the root cause of potential developmental delays or challenges, potentially leading to suboptimal long-term outcomes. This is ethically problematic as it deviates from the principle of beneficence by not fully addressing the child's developmental needs. An approach that dismisses parental concerns as unfounded without objective assessment risks alienating the family and overlooking crucial developmental cues. This violates the principle of respect for persons and can erode the therapeutic alliance, hindering effective care. It also fails to acknowledge the parent's unique insights into their child's behavior. An approach that relies on anecdotal evidence or unvalidated interventions, even if well-intentioned, is not supported by the regulatory framework for evidence-based practice. This can lead to ineffective or even harmful interventions, violating the principle of non-maleficence and potentially exposing the child to unnecessary risks. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the child's presenting concerns, considering all relevant developmental domains. This assessment should be followed by an analysis of findings in light of established developmental milestones and evidence-based practices. Collaboration with parents and other healthcare professionals is essential to develop a comprehensive, individualized care plan. Regular reevaluation and adjustment of the plan based on the child's progress and evolving needs are also critical components of effective pediatric clinical practice. Question 11. Process analysis reveals a 4-month-old infant presenting with a 2-day history of projectile vomiting and decreased oral intake, leading to lethargy and decreased urine output. Initial assessment indicates moderate dehydration. The primary care provider is considering immediate intravenous fluid resuscitation and broad-spectrum antibiotics. Which of the following management strategies best reflects current pediatric clinical specialist guidelines for this presentation? Option A. Provide intravenous boluses of dextrose-containing fluid to rapidly correct any potential hypoglycemia and then reassess hydration status. Option B. Administer oral rehydration solution every 15 minutes and encourage continued breastfeeding, as this is the first-line treatment for dehydration in infants. Option C. Initiate intravenous fluid resuscitation with isotonic crystalloids and closely monitor electrolyte levels and clinical status. If vomiting persists and the infant shows signs of sepsis, consider empiric antibiotics after obtaining appropriate cultures. Option D. Immediately start broad-spectrum antibiotics intravenously to address potential underlying infection, followed by gradual introduction of oral fluids once vomiting subsides. The correct answer is C. Initiate intravenous fluid resuscitation with isotonic crystalloids and closely monitor electrolyte levels and clinical status. If vomiting persists and the infant shows signs of sepsis, consider empiric antibiotics after obtaining appropriate cultures. Explanation. This scenario presents a professional challenge due to the inherent complexity of managing pediatric gastrointestinal disorders, which often involve a spectrum of severity, potential for rapid decompensation, and the need for multidisciplinary collaboration. The requirement for careful judgment stems from balancing the immediate needs of the child with long-term health outcomes, while adhering to established pediatric clinical guidelines and ethical principles. The correct approach represents best professional practice because it prioritizes evidence-based interventions tailored to the specific clinical presentation and the child's developmental stage. This aligns with the pediatric clinical specialist, PCS, role, which mandates the application of advanced knowledge and skills to optimize patient care. Adherence to established protocols for managing conditions like severe gastroenteritis, including appropriate fluid management, electrolyte monitoring, and consideration of advanced interventions when indicated, is crucial for preventing complications such as dehydration, electrolyte imbalances, and organ dysfunction. This approach is ethically sound as it upholds the principle of beneficence by acting in the best interest of the child and non-maleficence by avoiding unnecessary or harmful interventions. An incorrect approach that relies solely on empirical treatment without thorough assessment or consideration of differential diagnoses would be professionally unacceptable. This failure could lead to delayed or inappropriate management, potentially exacerbating the child's condition and violating the principle of beneficence. Another incorrect approach might involve prematurely escalating interventions without exhausting less invasive, evidence-based options, which could lead to iatrogenic harm and increased healthcare costs, contravening the principle of non-maleficence and responsible resource utilization. Furthermore, failing to involve or adequately communicate with the interdisciplinary team, including physicians, dietitians, and other specialists, represents a breakdown in collaborative care, which is a cornerstone of effective pediatric practice and can lead to fragmented care and adverse outcomes. Professional decision-making in similar situations should involve a systematic process. 1. Comprehensive assessment of the child's history, physical examination findings, and relevant diagnostic data. 2. Identification of the most likely diagnosis and consideration of critical differential diagnoses. 3. Application of evidence-based guidelines and best practices for the identified condition. 4. Development of a tailored management plan, including pharmacologic and non-pharmacologic interventions, with clear goals and monitoring parameters. 5. Continuous reassessment of the child's response to treatment and adjustment of the plan as needed. 6. Effective communication and collaboration with the interdisciplinary team and the child's family. Question 12. The risk matrix shows a moderate risk of assessment invalidity due to child anxiety versus a low risk of minor temporary distress. The pediatric clinical specialist is preparing to conduct a play-based assessment for a young child who is visibly hesitant and clinging to their parent. Which of the following approaches best mitigates the identified risks while adhering to professional and ethical standards for pediatric practice? Option A. Inform the parent that the child appears too anxious for assessment today and reschedule for another time without attempting any rapport building. Option B. Proceed with the assessment as planned, but verbally reassure the child frequently that everything will be okay, even if they seem distressed. Option C. Begin with a brief, unstructured period of free play to allow the child to explore the environment and build rapport with the specialist before introducing more structured assessment activities. Option D. Immediately commence the planned structured play-based assessment activities to ensure all necessary developmental domains are covered within the allotted time. Correct answer is C. Begin with a brief, unstructured period of free play to allow the child to explore the environment and build rapport with the specialist before introducing more structured assessment activities. Explanation: this scenario presents a professional challenge because the pediatric clinical specialist, PCS, must balance the need for a comprehensive play-based assessment with the child's current emotional state and the potential for distress. The risk matrix highlights that while a thorough assessment is crucial for effective intervention planning, the child's anxiety represents a significant risk factor that could compromise the validity and ethical conduct of the assessment. Careful judgment is required to select an approach that prioritizes the child's well-being while still gathering necessary information. The correct approach represents best professional practice because it acknowledges and directly addresses the child's anxiety as a primary barrier to effective assessment. By prioritizing rapport building and creating a safe, predictable environment, the PCS demonstrates adherence to ethical principles of beneficence and non-maleficence, ensuring the child's comfort and minimizing potential harm. This aligns with the core tenets of play-based assessment, which emphasizes observing the child in a naturalistic, low-stress setting to gain authentic insights into their development and needs. Regulatory frameworks and professional guidelines for pediatric practice universally advocate for child-centered approaches that respect the child's emotional state and promote a positive therapeutic alliance. An incorrect approach that proceeds with a full, structured play-based assessment without adequately addressing the child's anxiety would be professionally unacceptable. This would represent a failure to uphold the ethical principle of non-maleficence, potentially causing undue distress and exacerbating the child's anxiety. Could also lead to inaccurate assessment data, as a highly anxious child may not engage authentically or demonstrate their typical developmental skills. Furthermore, it disregards the importance of establishing trust, a foundational element for any therapeutic intervention with children, and could violate professional standards that mandate a sensitive and responsive approach to pediatric clients. Another incorrect approach would be to abandon the assessment entirely due to the child's anxiety. While prioritizing the child's comfort is essential, completely foregoing the assessment without attempting to mitigate the anxiety or reschedule would be a disservice to the child and their family. This could be seen as a failure to advocate for the child's developmental needs and could delay necessary interventions. It also fails to demonstrate professional problem-solving skills in adapting assessment strategies to meet the child's current needs. The professional decision-making process for similar situations should involve a systematic evaluation of the child's presentation, the assessment goals, and potential risks. This includes 1. Recognizing and validating the child's emotional state. 2. Prioritizing rapport building and creating a sense of safety. 3. Adapting the assessment plan to accommodate the child's current capacity for engagement. 4. Collaborating with caregivers to understand the child's typical behavior and potential triggers. 5. Documenting the observed anxiety and the rationale for any modifications to the assessment process. 6. Considering alternative assessment methods or rescheduling if the child's distress is too significant to overcome in the current session. Question 13. During the evaluation of a 7-year-old child with spastic quadriplegic cerebral palsy, a recent diagnosis of epilepsy has been made. The child's current management includes physical therapy for mobility, occupational therapy for fine motor skills, and speech therapy for communication. The new epilepsy diagnosis has led to the initiation of anti-epileptic medication. What is the most appropriate next step for the pediatric clinical specialist? Option A. Focus solely on monitoring the child's response to the new anti-epileptic medication and adjusting dosages as prescribed by the neurologist, assuming the existing cerebral palsy therapies remain unaffected. Option B. Rely exclusively on the recommendations of the neurologist regarding the child's overall care plan, deferring all decision-making about therapy adjustments to that specialist. Option C. Schedule a multidisciplinary team meeting to reassess the child's overall functional goals and develop an integrated care plan that addresses both cerebral palsy and epilepsy management, considering potential medication side effects on existing therapies. Option D. Recommend discontinuing or significantly reducing the intensity of existing cerebral palsy therapies to allow the child to better tolerate the new medication and focus on seizure control. The correct answer is C. Schedule a multidisciplinary team meeting to reassess the child's overall functional goals and develop an integrated care plan that addresses both cerebral palsy and epilepsy management, considering potential medication side effects on existing therapies. Explanation. This scenario presents a common challenge for pediatric clinical specialists, PCS, involving a child with cerebral palsy, CP, and a new diagnosis of a co-occurring condition. The professional challenge lies in integrating the new information with the existing CP management plan, ensuring a holistic and evidence-based approach that prioritizes the child's overall well-being and functional outcomes. Careful judgment is required to avoid siloed treatment, ensure interdisciplinary collaboration, and adhere to the ethical principles of beneficence and non-maleficence, as well as the regulatory framework governing pediatric care. The correct approach represents best professional practice because it emphasizes a comprehensive, interdisciplinary assessment and the development of an integrated care plan. This aligns with the regulatory framework for pediatric clinical specialists, which mandates evidence-based practice, patient-centered care, and collaboration with other healthcare professionals. By involving the family, consulting specialists, and reassessing functional goals, the PCS ensures that the treatment plan addresses all aspects of the child's health and development, promoting optimal outcomes and quality of life. This approach upholds the ethical duty to provide competent and comprehensive care. An incorrect approach that focuses solely on managing the new diagnosis without considering its impact on the existing CP management plan represents a failure to provide holistic care. This could lead to fragmented treatment, potential conflicts in therapeutic strategies, and suboptimal outcomes for the child. Ethically, it violates the principle of beneficence by not maximizing the child's potential benefits and could inadvertently lead to harm through uncoordinated interventions. Regulatory failure would stem from not adhering to standards of comprehensive pediatric care and interdisciplinary collaboration. Another incorrect approach that relies solely on the recommendations of the newly consulted specialist, without independent clinical judgment or integration with the existing CP expertise, fails to leverage the full scope of the PCS's role. This can lead to a plan that may not be optimally tailored to the child's specific CP presentation or functional abilities. Ethically, it could be seen as a delegation of responsibility without adequate oversight, potentially compromising the quality of care. Regulatory failure would occur if the PCS does not exercise their professional judgment and ensure the integrated plan is evidence-based and appropriate for the child. A third incorrect approach that prioritizes the new diagnosis over the established CP management plan without a clear clinical rationale risks destabilizing the child's existing progress and functional gains. This could be detrimental to the child's overall development and well-being. Ethically, it could be considered maleficence if the shift in focus leads to a decline in the management of the CP, which is a chronic and significant condition. Regulatory failure would involve deviating from established best practices for managing complex pediatric conditions without sufficient justification. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly review all available information, including the child's history, current CP management, and the new diagnosis. 2. Engage in a comprehensive assessment that considers the interplay between the CP and the new condition. 3. Foster open communication and collaboration with the child's family and the entire interdisciplinary team. 4. Develop an integrated, evidence-based treatment plan that addresses all aspects of the child's needs. 5. Continuously monitor the child's progress and adjust the plan as necessary, always prioritizing the child's overall well-being and functional independence. Question 14. Risk assessment procedures indicate that an infant presents with frequent spitting up, occasional fussiness during feeds, and adequate weight gain. The pediatric clinical specialist, PCS, is considering the most appropriate initial management strategy. Which of the following approaches best aligns with current pediatric guidelines and regulatory expectations for managing suspected gastroesophageal reflux disease, GERD, in this infant? Option A. Advise the parents that spitting up is normal in infants and no intervention is necessary. Option B. Initiate a trial of a proton pump inhibitor (PPI) to reduce acid production and alleviate symptoms. Option C. Recommend a trial of conservative management including smaller, more frequent feeds and upright positioning after feeds. Option D. Refer the infant for an upper gastrointestinal series, UGI, to rule out anatomical abnormalities. The correct answer is B. Initiate a trial of a proton pump inhibitor (PPI) to reduce acid production and alleviate symptoms. Explanation: scenario analysis. This scenario is professionally challenging because it requires a pediatric clinical specialist, PCS, to balance the immediate need for symptom relief in an infant with GERD against the long-term implications of treatment choices and the potential for over-medicalization. The PCS must consider the developmental stage of the infant, the severity and impact of the reflux on the infant's well-being and growth, and the evidence-based guidelines for managing pediatric GERD. Navigating parental concerns and ensuring shared decision-making while adhering to regulatory frameworks for pediatric care adds another layer of complexity. Correct approach analysis. The correct approach, which involves a comprehensive assessment of the infant's symptoms, feeding patterns, growth trajectory, and the impact of GERD on their quality of life, followed by the implementation of conservative, non-pharmacological interventions as a first-line strategy, represents best professional practice. This aligns with the principles of evidence-based practice and the regulatory framework for pediatric care, which emphasizes a stepwise approach to treatment, starting with the least invasive methods. The focus on lifestyle and feeding modifications is supported by guidelines that advocate for these interventions before considering pharmacotherapy, thereby minimizing potential risks and side effects associated with medications in infants. This approach prioritizes the infant's overall health and development, while respecting the principles of judicious use of medical interventions. Incorrect approaches analysis. One incorrect approach would be to immediately recommend or prescribe acid-suppressing medication without a thorough initial assessment. This fails to adhere to the principle of starting with conservative measures and could lead to unnecessary medication use, potential side effects, and masking of underlying issues. It bypasses the required diagnostic workup and evidence-based treatment algorithms, potentially violating regulatory guidelines that mandate appropriate justification for pharmacotherapy in pediatric populations. Another incorrect approach would be to dismiss parental concerns about the infant's discomfort and feeding difficulties, attributing them solely to normal infant behavior without adequate investigation. This demonstrates a failure in empathetic communication and a lack of thoroughness in the assessment process. Regulatory and ethical standards require healthcare professionals to take parental concerns seriously and conduct a comprehensive evaluation to rule out significant pathology or to identify appropriate management strategies. A third incorrect approach would be to focus solely on symptom reduction without considering the infant's growth and overall well-being. While symptom relief is important, the ultimate goal of managing GERD in infants is to ensure adequate nutrition, growth, and development. An approach that neglects these critical outcomes would be professionally deficient and potentially non-compliant with pediatric care standards. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough history and physical examination, including detailed feeding and symptom diaries. This should be followed by an assessment of growth parameters and the impact of symptoms on the infant's daily life. Based on this comprehensive evaluation, a stepwise management plan should be developed, prioritizing conservative measures such as thickened feeds, positional therapy, and smaller, more frequent feeds. Pharmacological interventions should only be considered if these conservative measures are ineffective and the GERD is significantly impacting the infant's health or well-being, with careful consideration of the risks and benefits and adherence to established pediatric guidelines. Ongoing monitoring and reassessment are crucial to adjust the treatment plan as needed. Question 15. Quality control measures reveal that a pediatric patient presenting with chronic abdominal pain, diarrhea, and failure to thrive has been managed for several months with a partially gluten-reduced diet, with some reported symptom improvement. However, formal diagnostic testing for celiac disease was not completed prior to initiating dietary modifications. Which of the following approaches best reflects current best practice for evaluating and managing this pediatric patient? Option A. Continue the current partially gluten-reduced diet, as symptom improvement suggests a positive response, and monitor growth and development closely. Option B. Immediately transition to a strict gluten-free diet without further diagnostic testing, assuming the partial gluten reduction has been beneficial and further testing is unnecessary. Option C. Refer the patient for genetic testing for HLA-DQ2/DQ8 alleles, and if positive, consider it sufficient evidence to confirm celiac disease and maintain a gluten-free diet. Option D. Reinitiate a standard gluten-containing diet for a period of 6-12 weeks to allow for accurate serological and endoscopic assessment for celiac disease, followed by a strict gluten-free diet if confirmed. The correct answer is D. Reinitiate a standard gluten-containing diet for a period of 6-12 weeks to allow for accurate serological and endoscopic assessment for celiac disease, followed by a strict gluten-free diet if confirmed. Explanation. This scenario is professionally challenging because it requires a pediatric clinical specialist, PCS, to navigate the complexities of celiac disease management in a pediatric population, balancing evidence-based practice with the unique needs of young patients and their families. The PCS must ensure adherence to established diagnostic criteria and treatment guidelines, while also considering the psychosocial impact of a lifelong dietary restriction. Careful judgment is required to interpret diagnostic results, develop individualized management plans, and provide effective patient and family education. The correct approach represents best professional practice because it prioritizes a comprehensive, multidisciplinary assessment and management strategy. This aligns with the principles of patient-centered care and the ethical obligation to provide the highest quality of care. Specifically, it involves confirming the diagnosis through appropriate serological and genetic testing, followed by the implementation of a strict gluten-free diet under the guidance of a registered dietitian specializing in pediatric celiac disease. Ongoing monitoring for nutritional deficiencies, growth parameters, and adherence to the diet is crucial. Furthermore, providing education and support to the child and family addresses the psychosocial aspects of managing a chronic condition, which is a key component of holistic pediatric care. This approach is consistent with established clinical practice guidelines for celiac disease and the professional standards expected of a PCS. An incorrect approach that relies solely on symptom resolution after a trial of a gluten-free diet fails to meet diagnostic rigor. This is a regulatory and ethical failure because it bypasses established diagnostic pathways, potentially leading to misdiagnosis or delayed diagnosis of other conditions. It also fails to confirm celiac disease definitively, which is essential for long-term management and preventing complications. Another incorrect approach that involves a less stringent gluten-free diet without proper diagnostic confirmation is also professionally unacceptable. This represents a failure to adhere to best practices and could lead to ongoing intestinal damage and nutrient malabsorption, violating the ethical duty to provide competent care. Finally, an approach that focuses only on dietary changes without addressing the psychosocial impact or providing comprehensive education to the family is incomplete and ethically deficient. It neglects the holistic needs of the pediatric patient and their support system, potentially leading to poor adherence and increased family stress. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's clinical presentation and history. Second, consult and adhere to current, evidence-based clinical practice guidelines and regulatory frameworks relevant to pediatric celiac disease diagnosis and management. Third, engage in shared decision-making with the patient and family, ensuring they understand the diagnostic process, treatment options, and the importance of adherence. Fourth, collaborate with a multidisciplinary team, including gastroenterologists, registered dietitians, and mental health professionals as needed. Finally, continuously monitor the patient's progress and adjust the management plan accordingly, always prioritizing the child's well-being and long-term health outcomes. Question 16. Regulatory review indicates that pediatric clinical specialists are expected to maintain a high level of vigilance when infants are introduced to new solid foods. A parent expresses concern that their 7-month-old infant has developed a mild, patchy rash on their cheeks and next shortly after consuming a new pureed vegetable for the first time. The infant appears otherwise content and is feeding well. What is the most appropriate initial action for the pediatric clinical specialist to take? Option A. Advise the parent to administer an over-the-counter antihistamine as directed for infants and to monitor for symptom resolution before the next feeding. Option B. Document the parent's concern and the infant's current well-being. Advise the parent to continue observing the infant for any changes and schedule a follow-up assessment in 24 hours. Option C. Reassure the parent that mild rashes are common with new foods and suggest applying a standard infant moisturizer, advising them to report only if the rash worsens significantly. Option D. Immediately discontinue the new food, document the rash and parental concern, and notify the supervising physician to discuss potential allergy management. The correct answer is B. Document the parent's concern and the infant's current well-being, advise the parent to continue observing the infant for any changes, and schedule a follow-up assessment in 24 hours. Explanation. This scenario presents a common challenge in pediatric care, identifying and managing potential allergic reactions in infants, particularly when introducing new foods. The professional challenge lies in the subtle and varied presentations of allergic reactions in this age group, the need for vigilant monitoring, and the importance of timely and appropriate intervention based on established clinical guidelines and regulatory expectations for patient safety. Careful judgment is required to differentiate between typical infant fussiness or digestive adjustments and a true allergic response. The correct approach represents best professional practice because it aligns with the fundamental principles of patient safety and evidence-based care mandated by regulatory frameworks for pediatric specialists. This approach emphasizes proactive monitoring for a range of potential allergic symptoms, prompt reporting of concerns to the supervising physician, and adherence to established protocols for managing suspected allergic reaction. This ensures that the infant receives timely and appropriate medical attention, minimizing the risk of severe complications and upholding the standard of care expected of a pediatric clinical specialist. Regulatory frameworks for pediatric care consistently prioritize early detection and intervention for adverse events, including allergic reactions, to protect vulnerable patient populations. An incorrect approach that involves dismissing parental concerns about a rash and attributing it solely to a common infant condition fails to meet the standard of care. This oversight represents a regulatory and ethical failure because it neglects the principle of shared decision-making and parental advocacy, which are implicitly supported by patient rights regulations. Furthermore, it demonstrates a lack of vigilance in monitoring for potential adverse drug reactions or food allergies, which could lead to delayed diagnosis and treatment, potentially violating guidelines related to patient safety and quality of care. Another incorrect approach, which involves waiting for more severe symptoms before documenting or reporting the rash, is also professionally unacceptable. This delay constitutes a failure to adhere to best practices in proactive patient monitoring and risk management. Regulatory bodies emphasize the importance of reporting any deviation from the patient's baseline status, especially in infants, as early signs of distress or adverse reactions can escalate rapidly. This approach could be seen as a breach of professional responsibility to advocate for the patient and could violate guidelines related to timely documentation and communication of patient status. A professional decision-making process for similar situations should involve a systematic approach. 1. Actively listen to and validate parental concerns. 2. Conduct a thorough physical assessment, looking for a broad spectrum of potential allergic symptoms e.g. rash, hives, swelling, respiratory distress, gastrointestinal upset. 3. Consult relevant clinical guidelines and institutional protocols for managing suspected allergies in infants. 4. Document all observations and parental concerns meticulously. 5. Communicate findings and concerns clearly and promptly to the supervising physician, recommending specific actions or further investigation. 6. Continuously reassess the infant's condition and response to any interventions. This framework ensures that all potential risks are considered and addressed in a timely and evidence-based manner, consistent with regulatory expectations for pediatric care. Question 17. Benchmark analysis indicates that a pediatric clinical specialist is assessing a 4-year-old child who is engaging in parallel play, demonstrating a strong sense of egocentrism and is beginning to understand simple cause and effect relationships through hands-on exploration. Based on Piaget's stages of cognitive development, which of the following approaches best guides the specialist's intervention planning? Option A. Implement strategies that encourage the development of conservation and seriation and introduce more complex social role-playing scenarios. Option B. Focus on sensory-motor exploration and object permanence and introduce simple imitation of actions and sounds. Option C. Propose activities that encourage symbolic play and the use of language to express thoughts and feelings, while introducing simple cooperative games that focus on turn-taking and sharing. Option D. Design interventions that emphasize abstract reasoning and hypothetical thinking, and introduce complex problem-solving tasks requiring logical deduction. The correct answer is C. Propose activities that encourage symbolic play and the use of language to express thoughts and feelings, while introducing simple cooperative games that focus on turn-taking and sharing. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatric clinical specialist to interpret a child's behavior through the lens of a specific cognitive development theory, Piaget's stages, and then apply that interpretation to a clinical decision regarding intervention. The specialist must move beyond simple observation to theoretical understanding and practical application, ensuring the intervention is developmentally appropriate and effective. Misinterpreting the child's stage can lead to ineffective or even detrimental therapeutic approaches. Correct approach analysis. The correct approach represents best professional practice because it directly applies Piaget's theory to the observed behaviors, accurately identifying the child's likely cognitive stage and proposing an intervention aligned with that stage's characteristics. This demonstrates a deep understanding of developmental psychology and its clinical relevance. For a pediatric clinical specialist, adhering to evidence-based practices, which include established developmental theories like Piaget's, is paramount. This approach ensures interventions are tailored to the child's current cognitive abilities, maximizing the potential for learning and progress while respecting their developmental trajectory. This aligns with ethical obligations to provide competent and individualized care. Incorrect approaches analysis. One incorrect approach might involve focusing solely on the observable behavior without attempting to understand the underlying cognitive processes. This fails to leverage theoretical frameworks that guide effective pediatric intervention and could lead to superficial or misdirected treatment. Ethically, this represents a failure to provide the most appropriate and evidence-based care. Another incorrect approach could be to apply interventions designed for a significantly older or younger child, based on a misdiagnosis of the cognitive stage. This would be developmentally inappropriate, potentially frustrating the child, hindering progress, and failing to meet their specific needs. This constitutes a failure in clinical judgment and a violation of the principle of beneficence. A third incorrect approach might involve disregarding Piaget's theory altogether and relying solely on anecdotal experience or intuition. While experience is valuable, it should be informed by theoretical understanding. Without a theoretical framework, interventions can become inconsistent and lack a solid foundation, potentially leading to suboptimal outcomes and failing to meet professional standards of practice. Professional reasoning. Professionals should employ a decision-making framework that integrates observation, theoretical understanding, and evidence-based practice. This involves 1. Thoroughly observing the child's behaviors and interactions. 2. Actively considering relevant developmental theories, such as Piaget's stages, to interpret these observations. 3. Hypothesizing the child's cognitive stage based on theoretical constructs. 4. Selecting interventions that are developmentally appropriate and aligned with the hypothesized stage. 5. Continuously evaluating the effectiveness of interventions and adjusting based on the child's response and further assessment, always grounding decisions in established pediatric clinical guidelines and ethical principles. Question 18. Compliance review shows that a pediatric clinic serving a diverse urban population is seeking to enhance its developmental screening practices. The clinic director has asked the pediatric clinical specialist, PCS, to recommend a strategy for selecting and implementing new developmental screening tools. Which of the following approaches best aligns with regulatory expectations and best professional practice for a PCS in this context? Option A. Focus on implementing the newest, most technologically advanced screening tools available, assuming their efficacy without requiring extensive staff training or validation studies. Option B. Select validated, age-appropriate developmental screening tools that are recognized within the relevant pediatric healthcare regulatory framework and ensure comprehensive training for all staff involved in their administration and interpretation. Option C. Implement a system where experienced clinicians rely primarily on their clinical judgment and informal observations, supplementing with a single, general-purpose screening tool for all age ranges. Option D. Prioritize tools that are widely available and inexpensive, even if their validation for the specific age group served is less robust, and train staff through brief on-the-job demonstrations. The correct answer is D. Prioritize tools that are widely available and inexpensive, even if their validation for the specific age group served is less robust, and train staff through brief on-the-job demonstrations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatric clinical specialist, PCS, to navigate the complexities of developmental screening in a resource-limited setting while adhering to established best practices and regulatory guidelines. The challenge lies in balancing the need for timely and accurate screening with the practical constraints of available tools, staff training, and patient access. The PCS must exercise careful judgment to ensure that screening processes are both effective and compliant, without compromising the quality of care or patient safety. Correct approach analysis. The correct approach represents best professional practice because it prioritizes the use of validated, age-appropriate developmental screening tools that are recognized within the relevant regulatory framework for pediatric care. This ensures that the screening process is evidence-based, reliable, and contributes to accurate identification of developmental delays or concerns. Adhering to established protocols for administration, interpretation, and follow-up is crucial for maintaining the integrity of the screening process and for facilitating appropriate interventions, aligning with the ethical obligation to provide competent and evidence-based care. Incorrect approaches analysis. One incorrect approach involves relying solely on informal observation without using standardized, validated tools. This fails to meet regulatory requirements for systematic developmental assessment and lacks the objective data necessary for accurate identification of potential issues. It also bypasses established professional standards that mandate the use of evidence-based screening instruments. Another incorrect approach is the selection of a screening tool that is not age-appropriate for the pediatric population being served. This can lead to inaccurate results, either by missing delays in younger children or by over-identifying concerns in older children, rendering the screening ineffective and potentially causing undue parental anxiety or delayed intervention. This violates the principle of providing appropriate and effective care. A third incorrect approach is the failure to ensure that staff administering the screening are adequately trained and competent in its use. This compromises the reliability and validity of the screening results, as improper administration can lead to significant errors. It also represents a failure in supervision and quality assurance, which are often regulatory expectations for healthcare providers. Professional reasoning. Professionals should approach developmental screening by first identifying the specific regulatory framework and guidelines applicable to their practice setting. This involves understanding which developmental screening tools are recommended or mandated. The next step is to select tools that are validated, age-appropriate, and culturally sensitive for the target population. Crucially, ensuring proper training and ongoing competency assessment for all staff involved in screening is paramount. Finally, establishing clear protocols for referral and follow-up for children identified with potential concerns is essential for a comprehensive and effective developmental screening program. Question 19. Implementation of a comprehensive parent interview for a newly diagnosed pediatric patient with a complex chronic condition. What approach best balances the need for detailed clinical information with the emotional and informational needs of the parents? Option A. Conduct a structured interview focusing on eliciting specific symptom details and medical history, providing minimal additional information to avoid overwhelming the parents. Option B. Initiate a collaborative discussion, explaining the purpose of the interview, actively listening to parental concerns, and providing clear, digestible information about the condition and next steps. Option C. Rely primarily on the child's ability to articulate their symptoms, supplementing with brief parental input only when directly asked for specific facts. Option D. Present a detailed diagnostic report and treatment plan upfront, allowing parents to ask questions only after reviewing all provided materials independently. The correct answer is A. Conduct a structured interview focusing on eliciting specific symptom details and medical history, providing minimal additional information to avoid overwhelming the parents. Explanation. This scenario presents a professional challenge due to the inherent vulnerability of pediatric patients and the critical role of parents as primary caregivers and advocates. A pediatric clinical specialist, PCS, must navigate the complex interplay of obtaining accurate information for diagnosis and treatment planning, while respecting parental autonomy, privacy, and emotional well-being. The challenge lies in balancing the need for comprehensive data with the potential for parental distress, mistrust, or misinterpretation of the PCS's role. Careful judgment is required to ensure that the interview process is conducted in a manner that is both effective for clinical assessment and supportive of the parent-child relationship. The correct approach represents best professional practice because it prioritizes a collaborative and empathetic engagement with the parents. This aligns with ethical principles of beneficence and non-maleficence, ensuring that the interview process aims to benefit the child by gathering accurate information while minimizing potential harm to the parent's emotional state or trust in the healthcare system. Specifically, it adheres to guidelines that emphasize open communication, active listening, and the provision of clear, understandable information. This approach fosters a therapeutic alliance, which is crucial for ongoing care and adherence to treatment plans. It also respects parental rights to information and participation in their child's care, as often stipulated in healthcare regulations and patient rights charters. An incorrect approach that focuses solely on extracting information without acknowledging parental concerns or providing context is professionally unacceptable. This failure constitutes a breach of ethical practice by potentially causing undue distress and undermining the parent's role as a partner in care. It may also violate regulations concerning informed consent and patient rights, as parents have a right to understand the purpose and process of clinical interviews. Another incorrect approach that involves making assumptions about parental understanding or motivations without verification can lead to miscommunication and mistrust, hindering effective collaboration and potentially impacting the quality of care. This demonstrates a lack of cultural competence and respect for individual differences, which are often addressed in professional practice standards and ethical codes. Furthermore, an approach that neglects to offer support or resources to parents facing challenging circumstances can be seen as a failure to uphold the principle of holistic care, which extends beyond the immediate clinical assessment to encompass the family's overall well-being. The professional decision-making process for similar situations should involve a systematic approach. First, the PCS must clearly define the objectives of the interview and the information needed. Second, they should consider the parent's likely emotional state and potential barriers to communication. Third, the PCS should plan to establish rapport, explain the purpose of the interview clearly and empathetically, and use open-ended questions to encourage detailed responses. Throughout the interview, active listening, validation of parental concerns, and opportunities for parents to ask questions are paramount. Finally, the PCS should be prepared to offer appropriate support or referrals if needed, ensuring a comprehensive and compassionate approach to care. Question 20. Strategic planning requires a pediatric clinical specialist to determine the most appropriate course of action when presented with a young child exhibiting subtle differences in motor skills compared to peers, alongside parental observations of slower progress. Which approach best guides the PCS in assessing and addressing potential physical developmental concerns? Option A. Prioritize interventions based on parental requests, assuming their observations accurately reflect the child's developmental trajectory without independent verification. Option B. Conduct a comprehensive physical examination focusing on gross and fine motor skills, postural stability, and coordination, comparing findings against established age-appropriate developmental milestones, and integrate this with parental input to formulate a diagnostic and intervention plan. Option C. Dismiss parental concerns if the child appears generally healthy and meets a majority of developmental milestones, focusing only on overt signs of significant delay. Option D. Immediately implement a broad range of therapeutic exercises without a detailed assessment, based on the assumption that early intervention is always beneficial regardless of specific findings. The correct answer is B. Conduct a comprehensive physical examination focusing on gross and fine motor skills, postural stability, and coordination, comparing findings against established age-appropriate developmental milestones, and integrate this with parental input to formulate a diagnostic and intervention plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatric clinical specialist, PCS, to balance the immediate needs of a child with potential long-term developmental implications, while also navigating parental concerns and differing professional opinions. The PCS must synthesize information from various sources, including the child's history, physical examination findings, and parental input, to make a sound clinical judgment regarding physical development. This requires not only a strong understanding of developmental milestones, but also the ability to communicate effectively and empathetically with the family. Correct approach analysis. The correct approach involves a comprehensive assessment of the child's gross and fine motor skills, postural control, and coordination, comparing these findings against established age-appropriate developmental norms. This approach is best professional practice because it is grounded in evidence-based developmental assessment principles, which are fundamental to pediatric care. It prioritizes a thorough, objective evaluation of the child's functional abilities, allowing for the identification of any deviations from typical development. This systematic process enables the PCS to formulate an accurate diagnosis and develop an appropriate intervention plan, aligning with the ethical obligation to provide competent and individualized care. Regulatory frameworks for PCS practice emphasize the importance of accurate assessment and evidence-based interventions. Incorrect approaches analysis. One incorrect approach would be to rely solely on parental reports of the child's abilities without conducting an independent physical assessment. This is a regulatory and ethical failure because it bypasses the PCS's professional responsibility to perform a direct evaluation, potentially leading to misdiagnosis or delayed intervention if parental observations are incomplete or subjective. It also fails to uphold the standard of care expected of a specialist. Another incorrect approach would be to dismiss parental concerns about developmental delays because the child appears outwardly healthy or meets some developmental milestones. This is an ethical failure as it demonstrates a lack of patient-centered care and disrespect for the family's observations and anxieties. It also risks overlooking subtle but significant developmental issues that may not be immediately apparent. A third incorrect approach would be to immediately recommend aggressive, unproven interventions without a thorough assessment and clear justification. This is a regulatory and ethical failure as it deviates from the principle of evidence-based practice and could potentially harm the child or place undue burden on the family. It also fails to establish a clear rationale for treatment based on the child's specific needs. Professional reasoning. Professionals should utilize a decision-making framework that begins with active listening and empathetic engagement with the family to understand their concerns. This is followed by a systematic, evidence-based assessment of the child's physical development, integrating objective findings with subjective reports. The PCS should then critically analyze the gathered information, comparing it to established developmental norms and considering potential contributing factors. Finally, the PCS should collaboratively develop a plan with the family, clearly explaining the rationale for any recommendations and ensuring ongoing monitoring and reassessment. This iterative process ensures that care is both clinically sound and family-centered.